Hi, my name is Chloe and I'm a social prescribing link worker at Community Voluntary Services Tendring. So how social prescribing works within our team is that each link worker is assigned to particular surgeries and then they have between sort of 2 and 5 surgeries that they work with. My role is a little bit different in that I receive my referrals from the Urgent Community Response Service and I do a lot of my work with them. So the Urgent Community Response Service, or UCRS as it's otherwise known, is a fairly new service. It offers people quicker access to physio and reablement care in their own homes to prevent hospital admissions that would otherwise be unnecessary. So patients are seen within 2 hours of the referral, and then they can get up to 2 days of support and care from the team. And then once they're discharged from the UCRS team, they go on to follow-up support. So it might be that they have a care package, or as a lot of the patients do, they come to the voluntary sector for ongoing support with things like collecting shopping, prescriptions and social prescribing support. So at the moment a lot of the referrals I'm receiving are for social isolation, so looking at getting people some befriending services or looking to join groups when they reopen, or Zoom fitness classes, support with finding cleaning services or other sort of home help, people wanting winter warmth packs or information on other services and support available in their local area. At the moment we're seeing a lot of referrals for people needing support with their mental health, and we were able to refer them to some really great local organisations for that. We also work quite closely with GP care advisors who are able to offer support with help sourcing any sort of equipment people need or benefits checks, and supporting people through the sort of GP and primary care pathways, which can be a bit confusing for some people. As a social prescriber, I have the time to have a longer conversation with the individual and find out what matters most to them going forward, and explore their options with them to see what sort of support they'd most benefit from, and also how they can help themselves and build up their motivation and confidence. What I like most about working in this team is that the Urgent Community Response Service actually goes out to people's houses and they can see what sort of things they've got going on in their lives, and that's not something that we're necessarily getting at the moment the full picture of by doing telephone calls. So they're able to give me a lot of really useful information about how I can support people, and then from their perspective I'm able to give them follow-up information once their 2-day period of support has ended. So it's a really useful collaborative relationship. So I've been working on the Urgent Community Response Service project since before it officially launched back in December, and it's been really great to be with the project since the start and have some input in how the teams work together. So really great at the moment because the whole point of the service is to reduce unnecessary hospital admissions, which is something that's so important with the current COVID-19 situation. So I'm really pleased to be working on a project that helps support this.